So having been diagnosed with localized prostate cancer, what are your options? They include active surveillance, brachytherapy, either low dose rate or high dose rate, external beam radiotherapy, a very specialised form of external beam radiotherapy called IMRT, sometimes combined with hormone therapy, surgery in all its forms. That includes open, laparoscopic or robot-assisted radical prostatectomy, or even some of the more experimental therapies such as focal therapy. It's very important to make the right decision, so it's something that shouldn't be rushed and should be meticulously considered. So what are the factors that might influence your decision as to which treatment you have? Firstly, the tumour. How big is the tumour? How aggressive is it? What's the Gleason score? Do you have other factors such as perineural invasion or vascular invasion suggesting it's a highly aggressive tumour? Is it a cancer which extends to both sides of the prostate or only one side? Is it a cancer that is outside of the shell, or has it spread further afield to the lymph glands? So these are the tumour factors. What about the personal factors? What are your priorities? How stable is your marriage? How important is sexual function to you? How fearful are you of urinary control issues or bowel issues? Do you really know whether you're a conservative type or a person who's prepared to have a more experimental procedure? These personal factors are really important in making the right choice. There are also prostatic factors. How big is your prostate? Are they leading to urinary difficulty? These will also impact on the correct choice of treatment. Even beyond the tumour factors, personal factors and prostatic factors, there are other factors that come into play. These include local factors. Have you had previous surgery in your pelvis? Do you have ulcerative colitis? Are you on various tablets such as warfarin and blood thinners? What's your general well-being like? Are you unwell? What's your life expectancy? All these can have an impact, as well as geographical factors. Maybe you live in the country and so some treatments are beyond your reach. Maybe there are financial factors that come into play. All of these factors can impact the final decision, and again, I can't stress strongly enough, there is no rush. So I think you're getting the idea now. It's a difficult and complex decision to decide what the right treatment is for you individually. So I think you're getting the idea now that it's a very complex decision to make the right choice. To make it with all these different options, with so many factors at play, you need to do it slowly. The principles that I emphasize are the following. You must not be rushed. You must find somebody who you trust, is empathetic and understands you. You must get at least another opinion if you feel uncomfortable with your first, perhaps a surgeon and a radiotherapist, or perhaps ask the surgeon or the radiotherapist to present your case at a multidisciplinary clinic. It's also important to ensure the level of experience of your clinician is high, as well as having the trust in that clinician. At the end of the day, you need to avoid regret. To avoid regret, you need to participate in the decision-making process. You need to understand the pros and cons of each treatment, and most importantly, you need to get to know yourself. You need to understand where you are in life, what's important to you, and what type of person you are. And knowing what type of person you are is only half the battle. Knowing your partner and his or her priorities is equally important, as well as sometimes friends and family. Everything needs to be taken into consideration. The prostate is a sexual organ. Probably the hardest decision is to understand its potential impact on sexual function. Clearly, with all the treatments, you're going to lose fluid with ejaculation. That's generally not a tragedy, but it could impact erections, it could impact orgasm, it could impact the length of the penis, and all these things need to be seriously considered and understood and internalized before you make your final decision. Let's go through some typical scenarios. 55-year-old man has a routine PSA test, has a biopsy, shows a low-grade Gleason 6 tumour. He would clearly be advised to have active surveillance because he has a relatively insignificant tumour, even in the long term. There is no need to remove the prostate because of the fear of cancer. There's no need to irradiate it. So you need to stand back, understand the literature that strongly supports monitoring this tumour and not be rushed into definitive treatment. Another typical scenario, 55-year-old man, father died of prostate cancer at 70, and he has regular PSA testing. The latest PSA went up, a biopsy was performed, it showed a Gleason 8 tumour. This is a significant cancer, particularly with the family history. This man, as it happens, also has an enlarged prostate with urinary symptoms. This man is best advised to have surgery to remove the prostate, hopefully at an early curable stage, and in addition fix up the urinary obstruction and enlargement, which will be improved after surgery and which would be aggravated by radiotherapy. Furthermore, he's young, and so follow-up treatment may become necessary, and radiotherapy is a much easier follow-up therapy than the other way round, i.e., if radiotherapy was used first and subsequent treatments needed, surgery is much more difficult than upfront. Another typical example, 69-year-old man who left it a little bit too long, PSA's 13, biopsy showed a high-grade Gleason 9. The urologist examines him and says that the prostate cancer is outside of the shell. In this particular instance, particularly as his prostate's not enlarged and he has no urinary symptoms, he's probably best advised to have a combination of hormone therapy and radiotherapy, which is more likely to cure him with less side effects than having surgery, which is likely to leave cancer behind, needing radiotherapy in addition. So in this man, he's better having radiotherapy than surgery. Another typical example, 68-year-old man with a Gleason 7 tumour who's been monitored for his cancer for the last 5 years and has recently developed a Gleason 7. His prostate's small, he doesn't have any major problems. He lives in the country, so 7 weeks of radiotherapy would be a great inconvenience. Brachytherapy for him is ideal. He's got the right type of tumour, he's in the right geographical location, he's got a small prostate with minimal urinary symptoms, and brachytherapy will give him the same cure rate. Another typical example, 73-year-old man who's got a rising PSA, an MRI shows one spot on the right side of the prostate. Very careful biopsies using transperineal biopsy shows that's the only spot. But it's a Gleason 7, so it's not insignificant, and his father's still alive at 98, so clearly he's got greater than 15 years life expectancy. He has a younger wife at the age of 55, and sexual function is a priority. For him, particularly as he's a person now in his later years and he accepts some risk of a newer therapy, I think he would be well advised to try the focal therapy program with the nano knife, understanding that ongoing monitoring would be necessary, but also understanding that sexual dysfunction is rare after this treatment, and so he might be therefore an ideal candidate for focal nanoknife treatment. The next example is an example of regret, something we need to avoid. 55-year-old man gets his routine regular check with his GP. His PSA is 3.1. He gets sent to the urologist. The urologist does a biopsy and finds 2 or 3 of the cores positive for Gleason 6 tumour. He basically freaks out when he finds out he has cancer because his wife had died of breast cancer only 10 years before, and a horrible death it was. He then rushes to the specialists, tells him he wants his prostate out, has his prostate out, and then becomes incontinent and impotent. This man did not need his prostate out. He now has the next 30 years of his life to regret his decision. This man should have sought a second opinion, should have taken a rain check and sat down and considered his options carefully and slowly and not in a rushed fashion. I understand this is a very emotive time, but you need to get on top of your emotions and make an informed decision. So you can see all factors need to be considered, a careful, planned strategy with expert clinicians that you trust, possibly second opinions, possibly multidisciplinary clinics. In addition, it's important to include all those who are close to you in this complex decision, including your wife or partner, your family, close friends, before making your final decision. With this more global overall approach, it's possible to have the right treatment at the right time for the right patient. If you do that, regret will be minimal, satisfaction high, and yet will still end up with minimizing your chance of dying of prostate cancer.